Hi there, in this video we are going to discuss about lipoproteins. Lipoproteins. Lipoproteins are the combination of lipids and proteins. The lipids here are usually cholesterols or cholesterol esters, and they are also phospholipids, and the proteins here are usually apoproteins, and these apoproteins are of 5 classes. It can be apoprotein A, B, C, D or E. So lipoproteins are a combination of proteins and lipids. Lipids include cholesterol esters or phospholipids, okay, or there can also be triacylglycerols. So what is the function of lipoproteins? Lipoproteins basically transport the the hydrophobic lipids in the blood. They transport hydrophobic lipids in the blood. For example, the cholesterol is a hydrophobic compound. Cholesterol esters are hydrophobic compounds. They cannot travel in the blood because they are not soluble in blood. So lipoprotein particles make them soluble in the blood. How they make them soluble? Uh, if we come toward lipoprotein, then the core of lipoprotein particle is made by this uh, cholesterol and cholesterol ester and triacylglycerol content, which make the core of lipoprotein particle. Then come the amphipathic apoproteins and phospholipids. Phospholipids come and surround this core. So apoproteins are amphipathic, having both polar and non-polar regions, and phospholipids are amphipathic, having both polar and non-polar regions. So what happens? They cover up this core. Their polar region interact with water or polar solvents, and their hydrophobic region interacts with this hydrophobic core containing cholesterol and cholesterol esters, and it then makes them soluble and transport them in blood. So depending upon their size, a general thing you should be remembering here the size of lipoprotein is inversely proportional to its density. Greater is the size, lesser is density, and size is directly proportional to lipid content. So greater is its lipid content, greater is its size. So now we come towards the types of lipoproteins. So types of lipoprotein include chylomicrons, low density, very low density lipoprotein, and high density lipoprotein. Coming towards chylomicron, they have high fat content or high lipid content is there in chylomicron, and then it is surrounded by apoprotein and phospholipid, and apoprotein and phospholipid content is low. Their largest in size, their size is largest, and density is smallest. So they are largest in size and smallest in density. They have high fat content and low protein content. Next we come toward very low density lipoprotein. Very low density lipoprotein have a size which is smaller than chylomicron, and it has also protein content in a similar way. Its density is somewhat greater than chylomicron, and size is lesser than chylomicron. Next we come towards low density lipoprotein. It also has high fat content, and its size is lesser than low density lipoprotein, and density is greater. Next we come towards high density lipoprotein. High density lipoprotein is smallest in size. It is smallest in size and highest in density. So it is highest in density and smallest in size. So high density lipoprotein has low fat content. It has high density lipoprotein has low fat content. It has low fat content, and it has high protein content. While these three structures have high fat or high cholesterol, you can call it high cholesterol, and less protein. So a general concept which I want to give you here, that low density lipoprotein and very low density lipoprotein, which are principally involved in transport from liver to body tissues, while chylomicron transports from intestine to liver, principally. So these low density lipoprotein and very low density lipoprotein, bad these are bad indicators of health, because they have less protein and high cholesterol. It means that they cannot efficiently transport cholesterol. So if there is increased very low density lipoprotein or low density lipoprotein, it means that cholesterol is present in the blood and that is not being efficiently solubilized because their protein content is less. So these are bad indicator of health, and they lead to the uh, cholesterol deposition in blood vessels. So they lead to the atherosclerosis and ischemic heart diseases. So very low density lipoprotein and low density lipoprotein increase the risk of ischemic heart disease, because these are synthesized by liver and transported to periphery. uh, and high density lipoprotein has high protein content and low cholesterol content. It means that this high protein content can solubilize cholesterol well. It solubilizes cholesterol well. So it is a good lipoprotein, and it decreases the ischemic heart disease risk. Low density lipoprotein and very low density lipoprotein, they are low in protein, high in cholesterol, so can lead to cholesterol deposition because cholesterol is not efficiently transported. High density lipoprotein is high in protein, low in fat, so its transport capability is better. So it is good lipoprotein and reduces the risk of ischemic heart disease. So it was a basic concept of good and bad lipoprotein particle which I wanted to give you here. So it was about general overview of lipoproteins. Thank you.